one part of our body that doesn't get much attention is our eyes. So let's have a look today and see how we can start taking better care of them.
Muller's is South Africa's first and oldest optometrist. After 121 years in business, the business is still in the hands of the Muller family. So we chatted to optometrist Dr. Peter Muller.
What is optometry?
Essentially is looking at the health of your eyes, assessing them for your visual needs, and making sure that you operate in the world in a far healthier and more functional manner.
Why is the eye such a special organ?
It's the one part of the body where you can see arteries and veins in the eye without having to open any part of the body. It's a very vital part of our body in terms of seeing and appreciating the world, and especially important from a health perspective, as a lot of diseases can be picked up by assessing your eye and looking into your eyes.
Regular optometric examinations are an important part of routine preventative health care, as many eye and vision conditions have no obvious symptoms.
Peter, can you tell us what's the general health of South Africans' eyes?
Well, when we look into the back of your eyes, we're looking at the arteries and veins and often see diabetic changes. Cataracts are quite a common condition, which is normally age-related, and also glaucoma, which is a pressure increase in the fluid in the eye, which causes blindness often in a large part of the population.
How often should we be going for screenings and eye tests?
Well, we recommend about every 2 years, but in your growing up years, annually until about the age of 18, and then every 2 years is perhaps a good norm. And as we get older, if there are conditions that require following, such as diabetic changes, might even be as often as 6 months. If there are pressure changes, annually would be certainly recommended.
What screen tests are there and how do you correct them?
We check for farsightedness, nearsightedness, astigmatism, presbyopia, binocular use of your eyes. Those are the standard tests we would do to correct vision. Farsightedness and nearsightedness is most corrected by spectacles or contact lenses. Presbyopia, which is a sort of middle-aged eye problem, we would look at correcting with a pair of varifocal lenses. And binocular problems, often you need to prescribe prism to align the eyes correctly.
80% of blindness is avoidable, which is why having your eyes checked is so important. An eye test is surprisingly affordable, and the wide range of frames and contact lenses available make eyewear fashionable and cost-effective.
Why can corrective eye surgery only be done once or twice in our lifetime?
Well, the condition is very dependent upon the thickness of the cornea. The first phase of it will correct most eye conditions, but the second phase will lead to a thin cornea, and operating further on a thin cornea can be very dangerous and very sensitive to causing other visual problems.
Peter, can you give us tips on how to take care of our eyes?
Well, apart from routine eye examinations to ensure that the eyes are healthy, UV protection against harmful UV rays and wearing proper sunglasses when outdoors is recommended. And then also, as we get older, often the retinal health can be supplemented by using a vitamin that can aid in the circulation to the key parts of the retina.
80% of eye problems are preventable and even curable, so it must be quite rewarding being in this industry.
Giving people sight, which makes them more efficient and productive in life, is very, very rewarding.
The key to maintaining good vision and preventing vision loss is early detection. So ensure you and your family get your eyes tested regularly and preserve your sight.